Learn about common ENT issues in kids and how to address them. Watch the video for valuable insights. Perceiving ear, nose, and throat issues in kids is urgent for guaranteeing their general well-being and personal satisfaction. Early detection and treatment can forestall complications and advance better health outcomes. This video digs into common ENT conditions in kids, their symptoms, and the available treatments, giving guardians the knowledge to resolve these issues effectively. Talking with an ENT expert is often necessary for accurate diagnosis and treatment plans. Wheezing and trouble breathing when snoozing. Rest apnea in children. What is rest apnea? Rest apnea is a serious problem where breathing repeatedly stops and starts during rest. It can affect all ages, including kids. In kids, it is often caused by enlarged tonsils and adenoids, obesity, or neuromuscular problems. Addressing kids' ENT conditions like enlarged tonsils and adenoids is vital for treating rest apnea in young patients. Symptoms of rest apnea in kids include noisy wheezing, an essential indicator of rest. Apnea is loud and frequent wheezing. Stops in breathing during rest. Noticing your child stop breathing suddenly during rest is a strong sign. Restless rest or frequent waking. Children with rest apnea may toss and turn throughout the night. Daytime drowsiness or social issues. Lack of quality rest can lead to excessive daytime sleepiness, irritability, and social issues. Bedwetting. Rest apnea can sometimes cause enuresis or bedwetting. The most common cause of rest apnea in children is the enlargement of the tonsils and adenoids. However, obesity and certain genetic conditions can also contribute to the development of this condition. Treatment options include adenotonsillectomy. Surgical removal of the tonsils and adenoids is often the first line of treatment and can significantly improve symptoms. Continuous positive airway pressure, or CPAP, for children who cannot undergo surgery or do not respond to it. CPAP therapy involves using a machine that delivers air pressure through a mask to keep the airways open during rest. Lifestyle changes. Weight management through diet and exercise can help in cases where obesity is a contributing factor. Ensuring the child sleeps on their side can also help reduce symptoms. Relentless hindered runny nose and mouth breathing. Enlarged adenoids and nasal sensitivities. Developed adenoids are small pieces of tissue located at the back of the nasal passage. They are part of the immune system and help trap harmful bacteria and viruses. However, when they become enlarged, they can block the airways, leading to breathing difficulties. Symptoms of enlarged adenoids include persistent nasal blockage. A constant stuffy nose is a common symptom. Mouth breathing. Children may breathe through their mouth instead of their nose, especially at night. Wheezing, like rest apnea. Enlarged adenoids can cause loud wheezing. Recurring ear infections. Enlarged adenoids can block the eustachian tubes, leading to frequent ear infections. Difficulty swallowing. Severe enlargement can make swallowing difficult. Treatment for enlarged adenoids includes non-surgical options like medications. Nasal steroids or antihistamines can reduce inflammation and congestion. Watchful waiting. In some cases, doctors may recommend monitoring the condition to see if it improves over time. Surgical options include adenoidectomy. Surgical removal of the adenoids is recommended if they cause significant breathing difficulties, frequent ear infections, or other complications. Nasal sensitivities, also known as allergic rhinitis, occur when the immune system overreacts to airborne substances like pollen, dust mites, pet dander, or mold. Now let's talk about the symptoms of nasal allergies in kids. A runny or stuffy nose is a common symptom that can be persistent. Frequent and repetitive sneezing is also a sign. Allergens can cause eye irritation, leading to itchy or watery eyes. Postnasal drip can result in a persistent cough. Dark circles under the eyes, often referred to as allergic shyness, are an indication of chronic nasal congestion. Dust mites are a common allergen and a significant trigger for nasal allergies. Managing exposure to dust mites is crucial for reducing allergic reactions. Here are some steps to reduce dust mite exposure. Regular cleaning is essential. Vacuum carpets and upholstered furniture frequently. Wash bedding in hot water weekly and use dust mite-resistant covers on mattresses and pillows. Humidity control is another important factor. Keep indoor humidity levels below 50% using dehumidifiers or air conditioning. Air purifiers can also help. Use high-efficiency particulate air. Keep filters to reduce airborne allergens. Medications such as antihistamines, nasal corticosteroids, and decongestants can relieve symptoms. Always consult a healthcare provider before starting any medication. Allergic rhinitis, also known as hay fever, happens when the nasal passages become inflamed due to airborne allergens like pollen, dust mites, pet dander, and mold spores. In children with allergic rhinitis, the immune system mistakenly identifies these harmless substances as threats, triggering the release of chemicals like histamine. This immune response leads to the characteristic symptoms of allergic rhinitis, including congestion, sneezing, and itchy eyes. There are two main types of allergic rhinitis. Seasonal allergic rhinitis, known as hay fever, is triggered by pollen from trees, grasses, and weeds. Symptoms occur during high pollen seasons like spring and fall. Perennial allergic rhinitis is caused by year-round allergens like dust mites, pet dander, and mold. Symptoms persist throughout the year but may vary in intensity based on allergen exposure. The symptoms of allergic rhinitis can significantly affect a child's quality of life, causing discomfort and disrupting daily activities. Common symptoms include persistent nasal congestion, frequent sneezing, often in fits, and a runny nose with clear nasal discharge. Itching can lead to rubbing, which worsens symptoms, and postnasal drip often causes coughing. Managing allergic rhinitis involves avoiding allergens, identify triggers by working with an allergist, reduce exposure by keeping windows closed during high pollen seasons, using air purifiers, and maintaining a clean living environment. Medications can also help. Antihistamines reduce sneezing, itching, and runny nose. Nasal corticosteroids are effective for reducing inflammation and congestion. Decongestants provide short-term relief from nasal congestion. Immunotherapy involves gradually introducing the child to increasing amounts of the allergen to build tolerance. This can be administered through allergy shots or sublingual tablets, and is often considered for severe cases of allergic rhinitis that do not respond to other treatments. Nasal allergies can disrupt a child's sleep, concentration, and activities. Poor sleep due to nasal congestion can cause daytime fatigue and irritability, affecting school performance and social interactions. Proper management of allergic rhinitis is essential to minimize these impacts and improve the child's overall quality of life. Understanding common children's ENT conditions, especially in the realm of pediatric ENT care, is crucial for timely intervention and effective management. Conditions like sleep apnea, enlarged adenoids, and nasal allergies can significantly impact a child's health and well-being if left untreated. Parents should be vigilant in observing symptoms such as snoring, mouth breathing, chronic nasal congestion, and frequent sneezing. Early consultation with an otolaryngologist can lead to proper diagnosis and treatment, ensuring better health outcomes for the child. By recognizing the signs and seeking appropriate care, parents can help their children breathe easier and enjoy a healthier, more comfortable life. Whether through surgical interventions, lifestyle changes, or medical treatments, addressing these ENT conditions promptly can make a tremendous difference in a child's development and daily functioning. Thanks for watching Understanding Common ENT Issues in Kids. If you enjoyed the video, share your thoughts in the comments.